Good evening, and thank you for joining tonight's community conversation hosted by the City and County of Broomfield. My name is Roger, and I will be your moderator this evening. Presenters tonight include Mayor Guylene Castriata, Mayor Pro Tem Stan Jezierski, Councilmember Laurie Anderson, City and County Manager Jennifer Hoffman, plus Public Health Director Jason Balling, Police Chief Gary Krieger, as well as additional Broomfield staff, all of whom are available to answer your questions tonight. Before we begin, I want to take a moment to tell you about the format for tonight's interactive call. Now, we realize some of you may just want to listen, and that's perfectly fine. But for those who would like to ask a question, we encourage you to press *3 on your phone. You'll be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until you are called upon. So go ahead and press *3 now if you already know your question, and we will follow the same process throughout the call tonight. If you hear something that generates a question, just press *3. We want to hear from as many folks as possible, so we will limit callers to 3 minutes to ask your questions. When it is your turn, I'll call your name and ask you to repeat it for our live audience. A note to our panelists and community members asking questions: please speak slowly and clearly tonight, as this year's town halls are being translated and streamed live in Spanish. If you'd like to listen in Spanish or ask your question to our moderators in Spanish to translate for the rest of the listeners, please call 855-543-3424. Again, to listen and participate in Spanish, please call 855-543-3424. Now it's my pleasure to turn the call over to Mayor Castriata for some brief opening remarks. Go ahead, Mayor.
Thank you very much. Good evening, everyone. This is Mayor Guylene Castriata. I'm so pleased to be back here with you tonight. And we want to hear from all of you and answer your questions and provide some updates on our current public health and safety topics in Broomfield. You will hear updates on our current fight against the COVID-19 public health crisis from our public health director, an update from our police chief, Gary Krieger, regarding our continued efforts around public safety as the nation faces an increase in crime rates. You'll have an update on our oil and gas health symptom research study being conducted in collaboration with the Colorado School of Public Health's University of Colorado Anschutz campus. We look forward to your questions and are grateful you called in tonight. Thank you for your continued engagement, which makes Broomfield a wonderful community. Now I'd like to turn it over to Mayor Pro Tem Stan Jezierski. Stan?
Thank you, Mayor Castriata. And thank you, Broomfield, for joining us tonight on this call. As a father and business owner, it's hard to believe the pandemic is still so impactful on all of our lives. 18 months in. While vaccines for those under 12 are under review by the FDA, we're asking those of you who are eligible to please get vaccinated. It's vital for our students and our economy to keep the community and schools healthy, open, and operating as normal as possible for the greater good. I'm so proud of this community for coming together, staying engaged, getting vaccinated, and supporting each other through this long and tumultuous journey. Please keep it up and do your part. And with that, I will turn it over to my colleague, Council Member Laurie Anderson. Laurie, take it away.
Thanks, Mayor Pro Tem Jezierski, and all of you for your continued engagement on these telephone town halls and beyond. I echo Mayor Pro Tem Jezierski's message to do your part as an individual to protect the physical and mental health of our community, and especially our students and children, by keeping them protected from the virus and in school in person. The toll on this generation will be studied for decades to come, and I hope as a community we can be remembered for prioritizing the mental health of our families, friends, neighbors, and fellow community members. Now, as Assistant City and County Manager Abby Yeoman's time to share more about Broomfield's upcoming efforts around other public health and safety issues like oil and gas and crime prevention. Abby?
Thank you, Councilmember Anderson. Good evening, everyone, and thank you for being with us tonight. As I come up on my own 5-year anniversary in Broomfield, just had me reflecting on what a special community we really have. And we've really shown it over the last 18 months about what it means to be resilient and engaged when times are good and when times are tough. Public health and safety has and always will be the top priority for the city and county of Broomfield. With that in mind, we wanted to be sure you have the most up-to-date information and reliable information when it comes to concerns around public health and safety issues. For an update on upcoming oil and gas developments, we have our multidisciplinary team here to answer your questions. From the enforcement team, Andrew Valdez can answer questions about the upcoming drilling schedule and enforcement measures. And for our current oil and gas health symptom research being conducted in partnership with the Colorado School of Public Health, both senior environmental epidemiologist Dr. Megan Weisner and Dr. Lisa McKenzie are available tonight. The overall goal of the study is to contribute to a more comprehensive understanding of self-reported health symptoms near and away from unconventional oil and gas development across the city and county of Broomfield. This will include the potential association between air quality events, such as increased levels of benzene, and health symptoms. This research builds upon the existing knowledge of health symptoms reported near oil and gas development through our health concerns program, which has limitations with the sample size. Before I introduce Chief Krieger, who's also with us tonight, I wanted to remind you to vote in the upcoming election. We are less than 2 weeks away. You should have received your ballot, and no matter who you vote for, please just get out and vote. Ballots must be in by 7 p.m. on November 2nd. You can drop off your ballot in a secure 24/7 ballot drop box anytime between now and Election Day, November 2nd. You can also vote in person or get help with the process by visiting the Voter Service and Polling Center located here at 1 DeCombs Drive at the main city and county building. Don't hesitate to reach out directly to the Broomfield Elections Division if you have any specific questions or concerns. They're happy to help you. You can find contact information, ballot drop box locations, and more at votebroomfield.com. Again, that's votebroomfield.com. Now I would like to introduce the guy that I like to call my partner, Police Chief Gary Krieger, for an update on our public safety crime trends and statistics. Chief?
Thanks, Abby, and good evening, everybody. Broomfield is, and has always been, a very safe community where residents enjoy a high quality of life. The violent crime rate is one of the lowest in the state of Colorado. That being said, Broomfield is the fastest growing city and county in the state and contained within a very fast growing metropolitan area. While crime rates fluctuate yearly and by the type of crime, overall Broomfield's crime rate has steadily increased since 2017. This mirrors what neighboring cities and counties are also experiencing in response to the growth. As the public health orders have gradually eased, the criminal justice system has slowly started to reopen. The detention center is now accepting a greater number of arrestees. Courts are resuming normal operations, and people who victimize others are finally being held accountable. Shortly after the start of the pandemic, the police department experienced an increase in calls for service, and the crime rate started to rise, not just in Broomfield, but across the country. For example, auto thefts and break-ins in Broomfield have nearly doubled. Violent crime or crimes against person has always also risen. That being said, please remember this type of crime is rare in Broomfield. In addition, non-criminal calls for service have increased in the areas of mental health, addiction, suicide, and the unhoused. Broomfield crime reports crime data to the state of Colorado and the Federal Bureau of Investigation using the National Incident-Based Reporting System, often referred to as NIBRS. This system reports crime by victim, and it's important to note that multiple victims are counted in a single event. Reporting occurs monthly and is accessible to the public on the state of Colorado's website. Look at the Colorado Bureau of Investigation. In addition, I'd be remiss if I didn't address the new legislation that passed in response to several tragic events that occurred across this country. The House and Senate bills have led to some of the most substantial police reform in the history. I'm proud to say the Broomfield Police Department responded quickly, completely, to ensure our policies and our training were in compliance. The Broomfield Police Department exceeds the expectations of both the legal mandates and resident expectations. We pride ourselves in our adherence to our script values, which include service, compassion, respect, integrity, professionalism, and trust. To that end, in Broomfield, we are also grateful that our PD has not experienced the phenomenon that many police departments are experiencing across the state of Colorado and the nation in regards to staffing. Our staffing levels remain solid as we continue to focus our training, morale, and culture on promoting stability in order to continue to keep our community safe and healthy. While the Broomfield Police Department continues to exhaust all efforts to keep the community safe, it's important to remember that crime prevention is a shared responsibility. We rely on residents to tell us about suspicious and criminal activities in their neighborhoods. Residents are our eyes and ears that can make a difference in reducing crime in the community. Along with 911, our non-emergency number is a tool for residents who want to report core crimes. That number is 303-438-6400. Again, 303-438-6400. We also encourage residents to lock their homes, their cars, their windows, and their garage doors to discourage crimes of opportunity. Broomfield remains one of the safest communities in Colorado, in the nation, to live and work and visit. We offer a tremendous quality of life for our residents and visitors. Together, we will overcome the challenges as a result of the pandemic and return to a more normal life. Now let me introduce Public Health Director Jason Balling. Jason?
Good evening, everyone, and thanks for joining us. I do want to remind you that we want to hear from you and your questions, so please press *3 to get your questions in. Thank you, Abby, for mentioning the upcoming oil and gas health study Broomfield Public Health and Environment is conducting with the University of Colorado. This survey was designed by research professionals from the University of Colorado and our senior environmental epidemiologist. While Dr. McKenzie and Dr. Weisner can tell you more, please do take the time to fill out the survey if you are one of the randomly selected homes sent an invitation to participate. Those postcard invitations were mailed last week and have started showing up in the mail. Now for a quick COVID update. Youth ages 6 to 11 and 12 to 17 continue to have the highest COVID-19 rates statewide. Luckily, in Broomfield, vaccines, along with the prevention tools in schools, like masking indoors, enhanced filtration, cohorting, and more, are working to keep our youth safe and able to continue in-person learning. On October 26th, the FDA will review and make a recommendation on the Pfizer data for 5 to 11-year-olds. Yesterday, the FDA approved booster shots of the Moderna vaccine and the Johnson & Johnson vaccine. Today, the CDC's Advisory Committee on Immunization Practices met and recommended a half-dose booster shot for some Moderna recipients, people aged 65 and older, and those at high risk due to medical conditions or their jobs. These are the same recommendations that were adopted for the Pfizer booster. The committee also recommended booster doses for all Johnson & Johnson recipients aged 18 and older, at least 2 months after they received their initial shot. The advisory committee approved the use of each available vaccine as a mix and match booster in eligible populations. And as a reminder, Pfizer boosters are already available for certain populations. In addition, our hospital capacity is very stressed in Colorado. Our ICU bed isolation utilization is at the highest it's been throughout the pandemic. Hospitalization and deaths continue to be primarily among those who are unvaccinated, demonstrated that hospitalizations are largely preventable through vaccination. In fact, Governor Polis commended Broomfield for having high vaccination rates and low hospitalizations, and shared the state data continues to clearly support the correlation. That is, counties with higher vaccination rates, like Broomfield, tend to have lower hospitalizations, and counties with lower vaccination rates tend to have higher hospitalizations. You guys have been there throughout this. Let's keep the momentum up, Broomfield. If you're still in need of a vaccine or eligible for a third dose or a booster, you can find easy and convenient locations at broomfield.org/COVID vaccine. I will now introduce Dr. Megan Weisner and Dr. Lisa McKenzie to discuss the oil and gas health survey. Dr. Weisner?
Hello, I'm Dr. Weisner, and I'm the Senior Environmental Epidemiologist for the City and County of Broomfield. I hold a PhD in geosciences with an emphasis on understanding complex relationships between environmental contamination issues and impacts to human health. I've been working for the City and County of Broomfield for the last year and a half and have focused the majority of my work on oil and gas related topics. I've devoted a great deal of my time to understanding Broomfield's current situation with regards to oil and gas development and the need for a more robust health study. And as many of you already know, these efforts are currently underway. We are collaborating with the Colorado School of Public Health at the University of Colorado Anschutz campus to better understand the potential health implications of living near oil and gas development in Broomfield. The research methodology involves capturing self-reported health symptoms throughout Broomfield and conducting spatial analysis to understand potential associations between health symptoms and distance to unconventional oil and gas development. To accomplish this, we have developed a health survey that has been mailed out via postcard to approximately 1,600 randomly selected households in Broomfield. And some of you may have already received this. The postcard has a unique link and QR code that you can scan on your smartphone to take the survey. Now, Dr. McKenzie will talk a little bit more about the survey design. Dr. McKenzie?
Thank you, Dr. Weisner. Hi, everyone. I'm Dr. Lisa McKenzie, and I'm an assistant professor at the Colorado School of Public Health at the University of Colorado Anschutz campus. I have been researching the health implications of developing oil and gas in residential neighborhoods for the past 11 years. I'm really very excited about this opportunity to do work with Broomfield to do this study. The survey we're using was designed by research professionals from the University of Colorado, including myself and Dr. Weisner. The research methodology involves capturing self-reported health symptoms throughout Broomfield and conducting spatial analysis to understand potential associations between those self-reported health symptoms and distance to the unconventional oil and gas development sites in Broomfield. This research methodology has gone through rigorous design and review, and it has been approved by the Colorado Multiple Institutional Review Board at the University of Colorado. The goal of this study is to gather Broomfield-specific data so that we can have a better understanding of oil and gas in Broomfield, in the community of Broomfield. Your responses will help inform the City and County of Broomfield, health experts, policymakers, and the broader scientific community about the potential health implications of living near unconventional oil and gas development sites in Broomfield. We hope that you complete the survey if your household is randomly selected. This is important. Every response we receive makes the study findings stronger. Once we close the survey, we will begin the data analysis. We anticipate that we will be able to share the findings in late spring of 2022. To keep track of the study timeline, find answers to frequently asked questions, and to submit your concerns, visit broomfield.org/health survey, and health survey is one word there. This webpage will be kept up to date throughout the duration of your study. Roger, back to you.
All right, thank you. Some great information there, and lots to talk about. So as a reminder, please press *3 to get in the queue to ask a question. We've got some questions coming in, and we're going to get to those right now. Norm, you're first. Go ahead.
Yeah, my first question was to the chief. When he talked about the trend of vehicle thefts in and around Broomfield, is that by month? Is the trend going upward or downward of the vehicles that have been vehicles or even places in the neighborhoods that have been robbed or whatever? Is that trend up or down?
Hi, Norm. Gary Krieger, the police chief. So we track it monthly, and it'll vary by month, but we also look at it year to year. And what we're seeing, not only here in Broomfield, but across the metro area, that it's about doubling each year, which is a very disturbing crime statistic. What we see is they'll steal a car in, say, I don't know, Aurora, Denver, and then they'll bring it up here, use it for whatever reason, and then leave that car here, steal a Broomfield car, and go to Lakewood and do something. And so they're kind of taking these cars from different locations and using them for different things. We don't really see an area that is specifically hard hit, although they'll tend to be at times parking lots. Oftentimes it's cars that are unlocked. They'll find the car unlocked, and so they can get into them fairly easy. And that's the reason we encourage everybody to make sure they lock their car and remove their valuables from them. It's just an amazingly disturbing crime trend with the auto thefts, and it's very difficult for us to detect. We mostly have to follow up on the cases through our detectives and make arrests. And we've made a lot of arrests on people for auto theft. Hope that helps to answer your question.
Thank you, Chief. Again, if you'd like to get in the queue to ask a question, please press *3. We're going to hear from Karen next. Go ahead.
Yes, my question was concerning the crime rate. I feel that the American people, if the crime rate is going to go up because the American people are tired. They don't have money to raise their children. Now, they're getting ready to try to pass this $3 trillion bill. Why won't they take that money instead of putting it on streets and roads and give it to the American people so they'll be able to pay their rent, buy food, take care of their children?
Hi, Karen. This is David Allen. I'm the Assistant City County Manager here. And thank you for the question tonight. Unfortunately, your question really gets to federal legislation that is happening that Broomfield doesn't have local control over. And so, the uses of the funding that's going to be going along with this legislation, the best thing for you to do would be to either contact one of our 2 senators, federal senators, or contact your local congressperson to share your comments and desires with this bill. Thank you.
All right. Thank you. For those of you that joined us late, good evening. I'm Roger, your moderator tonight for this interactive community conversation hosted by the City and County of Broomfield. Mayor Guylene Castriata, Mayor Pro Tem Stan Jezierski, and City Council Member Laurie Anderson. And we've got a whole slew of city and county staff available to answer questions as well. If you'd like to ask a question, again, as a reminder, please press *3 on your phone, and you'll be transferred to an operator who will take down some basic information. I'll also mention might remind you that if you don't want to speak to an answer, or you need to leave the call early tonight, we certainly hope you'll stick around for the full hour. But if you need to leave the call early, you can press *9 and on your way out, leave us a voice message. So *3 to ask a question or comment live, and *9 to leave the call and leave a voice message. Let's get back to questions. Next up is Tom. Go ahead.
Hi, I have a couple of questions. I have one for Dr. McKenzie, perhaps. You mentioned that there is unconventional oil and gas exploration. I'd like to understand what that means.
I believe what we're meaning by unconventional oil and gas exploration is the exploration of the shale, the Niobrara Shale in Broomfield. Shale is sometimes referred to as an unconventional resource. I don't know if Dr. Weisner would like to expand on that.
Sure. Thank you, Dr. McKenzie. I get this question every now and again, and unconventional in the scientific literature, a lot of times, and what I mean by using the word unconventional oil and gas development is horizontal fracturing. Conventional gas development is generally vertical fracturing. That technology has been around for a long time. Unconventional is a more recent technology where they break up that shale bed using a horizontal technique where they go down vertically and then out horizontally.
All right, let's go back to Norm for a question. Go ahead.
Yeah, my other question, this may be to the mayor. The trend of
interim mayor.
The interim mayor is the trend of homeless. Is that a huge issue here in Broomfield? I thought it was just something that was just very minor at this point in time, even though we do have to deal with those issues. But it is a major concern right now.
Norm, this is Chief Krieger, and then I'll try and answer the question. Then maybe the mayor would like to add some thoughts as well. So there's no metropolitan area in the United States that isn't dealing with homelessness. And Broomfield, while the numbers are generally considered relatively small, they're also difficult to quantify. We do a point in time study every year where we try and quantify them, but that number is constantly fluctuating. Generally, the officers are pretty familiar with the people that are camping or encampments, but it's difficult to quantify people that are couch surfing on friends' homes or living in cars where we haven't had an opportunity to talk with them or offer services to them. So it's a number that is somewhat tenuous at best, but it's not, we don't have the problem that you see in like Denver and some of the other larger cities. Mayor, did you want to add anything?
Yes, I would. I mean, last time I got information on the number of people that were being contacted. There wasn't anyone in the system. Is that correct, Chief? Has that changed since maybe a week ago or 2 weeks?
Well, we have our chart team up, but I think that's pretty close. We've been working to try and get them services and out of the encampments.
How many is that? How many people are we talking about?
One or two, Mayor. Again, that number kind of fluctuates week to week, but it's a small number.
So as you can see, we don't have the prevalence of a lot of our neighboring communities, and we're fortunate. We were concerned when Boulder and Denver were going to do sweeps. We thought that we would have more people in Broomfield, but that never happened. So I think we're in pretty good shape. Thank you.
All right, again, *3 to ask a question. Let's hear from Tom next. Go ahead.
I have a question for the chief.
Go right ahead.
Chief, I appreciate your service and I thank you for that. My question is specifically around fentanyl and the use of fentanyl and how that's affecting our community. And what you guys have found in terms of usage, so on and so forth, and how do we protect our kids from this really bad thing?
Sure, Tom. Thanks for the question. So drugs in society are kind of ebb and flow as society moves, and we also see a recycling of them through generational periods. And a few years ago, we had a lot of discussion about heroin, which seems to be dropping off. Fentanyl is resurging and has been for the last couple of years. I think the concern with fentanyl is the potency. It's about 50 to 100 times more potent than heroin. And so the risk of overdose is very large for users of it. It also can be placed into other drugs and sometimes without the user knowing. So we're always with our North Metro Drug Task Force partners pursuing any of the fentanyl use or especially sales that are occurring in and around Broomfield. All of our officers carry the Narcan, and we do use it periodically on people that are overdosing. So it's not so large that it's everywhere, but I wouldn't. I'd have to say that it is available in the community, and it is something that when you talk to your kids, it's absolutely critical that to not only talk to them about any drug use that's non-prescribed for health reasons, but especially talk to them about the potential of not getting what you think you're getting and the presence of fentanyl, because it is a very dangerous drug.
Hey, Chief, it's Jason over in Public Health, and One thing I'd like to add is obviously substance misuse or abuse is a concern to our entire community, and we have a very strong working relationship and partnership with both mental health partners and Community Reach Center for people to access services they may need. As far as preventing youth from starting substances, we have an active coalition called the Communities That Care. And there's a group advisory board of teens and youth that are advising us. And 3 areas we found is to reduce the availability of drugs is really key. Secondly, is to increase those protective factors. Having a trusted adult in a teen's life really makes a big difference. And then lastly is the community connectedness. How do we get our community, create that sense of belonging where people may not then drift to substances. So we are working heavily in that area and we'll continue those efforts. Thanks.
All right, great information. Again, star 3 if you'd like to ask a question. We're going to hear from Jeff next. Go ahead.
Hi, yes, thanks for taking my question this evening. I was just wondering if you could explain a little bit more about this is for the oil and gas study. Just explain a little bit more about the scientific basis for that study. As I understand how it's been explained, we're looking for the potential relation between self-reported health issues and unconventional oil and gas installations. And I'm just wondering what other potential factors are going to be included in the study, such as, spatial relation to, shopping centers and or any kind of contract tracing related to COVID or vaccination status related to COVID, the myriad of other factors that could be involved here. And if you could just explain the kind of scientific basis of focusing on that one specific factor the study seems to have singled out.
Thank you so much for that question. And I can start out with the response to that. So what we did, we looked at a lot of different oil and gas studies that have been conducted across the United States. And Dr. McKenzie is quite a leader in a lot of this oil and gas research. So we looked at what other studies have been doing, and we are building off of the existing scientific literature. So what we're doing is looking at health symptoms all throughout the city and county of Broomfield. So we're asking residents to complete the survey, no matter if they live near oil and gas or away from oil and gas. And then we'll take a look at those symptoms, and we can do a bit of geospatial modeling to see, do symptoms differ? Are there any patterns in symptoms at various distances from oil and gas development? But I think, to your point, there are a lot of variables that can go into symptoms. So we are asking for certain confounding variables like your health status, any other pre-existing conditions, what your occupation is that could help us identify other exposures. And so we're taking a lot of those things into consideration. And thank you. Dr. McKenzie, do you have anything to add onto that?
I would just add, we also have a great set of data in Broomfield with all the air quality data that's being collected in Broomfield. And we can also use concentrations of different air pollutants that are being detected in the time that people are responding to the survey and do some analysis there too. And like Dr. Weisner said, we are accounting for other confounding variables in the study, where we're asking people actually quite a few questions about themselves. So we also have age and ethnicity and gender and all of that in there, whether or not they smoke. So we're looking at a lot of other factors, and we can, if we see that it might be a confounding factor, we know the locations of other sources of air pollution in Broomfield that we can bring into account to the study if we need to.
All right, thank you. Again, just a reminder, We've got about 20 minutes left. If you have a question you'd like to ask our distinguished panel, please press star 3. I'm going to hand the call over next to Abby Yeoman, who's got a few additional tidbits of information to share. Go ahead, Abby.
Thank you, Roger. I am actually going to ask Clay Shuck, our amazing Director of Parks, Recreation, and Senior Services, to talk a little bit about some upcoming events that they will be hosting here in the next couple months. Clay?
Good evening, Broomfield. Hope everybody's enjoying the town hall call this evening. I just want to share with you some community events that are coming up. First one I want to talk about is our ever fabulous and great opportunity to bring it back to Broomfield is our Jingle Bell Market Craft Fair. That'll be on Saturday, November 20th from 8 to 3 at the Broomfield Community Center. The annual Jingle Bell Market Craft Fair features 5 rooms filled with crafters from all over Colorado. And we are sure you can find something special for everyone on your holiday list. The other event that I want to talk about is our holiday tree lighting ceremony on Friday, December 3rd. This annual community event is when all of Broomfield welcomes the arrival of Santa Claus at the George DeCero City and County Building. The air is filled with local children singing carols. The community trees are lit and looking spectacular, and the mayor lights the community holiday tree. Families can enjoy free cookies, rides on the holiday wagon, and children are able to talk to Santa Claus. Make sure you bundle up though. It's always chilly that evening, and come and share in the holiday cheer. Last but not least, we have reserved on Saturday, December 4th, Santa Claus to call and talk to your child between the hours of 9 and noon. Please use the form to register your child for a call and be sure to have your child near the phone number submitted on the form during the time you select. The deadline to submit the form to have Santa give your child a call is 5 p.m. on Thursday, December 2nd. Thanks, Abby. I'll turn it back over to you.
Thanks, Clay. I'm going to turn it back over to Roger. It looks like we have a couple more questions.
We do. Thank you. I'm so excited that folks are able to get back together in person for these holiday events. Let's hear from Tom again. Tom, go ahead.
Hi, my question is for perhaps Dr. McKenzie or Dr. Weisner regarding the air quality analysis that they're doing. Does that include other like seasonal allergens and things of that nature, or is it just strictly related to the pollutants from the air around those specific sites?
Thank you, Tom, for that question. Broomfield has a very robust air quality monitoring program. We are looking at a lot of different contaminants of concern. Many of those contaminants are tied to oil and gas operations. And some contaminants are like particulate matter, PM 2.5, that has various sources that it comes from. So some things are a little bit harder to determine where they come from, but we have air quality experts from Colorado State University and Ajax Analytics, the Department of Atmospheric Sciences at CSU. They analyze a lot of our air quality data, and Dr. Detlev Helmig's team does as well. So they provide us with all sorts of different information, and a lot of times they can tell us that there were some air pollutants in the air, and the signature of those pollutants is very much classified as an oil and gas signature, or sometimes it's more traffic related. And so we're a lot of times able to distinguish the difference between where the sources may be coming from, but sometimes it's a little bit trickier. So we're certainly taking all of that into account as we look at these health symptoms that are being reported.
And those are all documented as part of the study?
The air quality monitoring program is complementary to the study. It's a program that has been going on in Broomfield for quite some time, and all of that information is publicly available. We do have city council meetings with quarterly reports on the air quality, but we will certainly be using that data for the larger health symptoms study that Dr. McKenzie and I are working on together.
All right. Let's go to Andy next. Andy, go ahead.
Oh, yes. Thank you for taking my question this evening. This question is probably for Jason. Jason, you mentioned something about enhanced ventilation as a way to improve air quality, and I was wondering to what extent Broomfield Public Health is aware of what school districts that serve Broomfield are able to bring about enhanced ventilation so that our children are able to study safely in person in our schools. So is Broomfield Public Health aware of what might be happening with each of the school districts with respect to enhanced ventilation in the schools?
Yes, great question, Andy, and I'm glad that you brought it up. So often when we talk about in-person learning, masks tend to be the focal point, but we know it takes layered mitigation to maintain in-person learning. And I would say we've been very successful in the Denver metro region, and especially in Broomfield, in keeping our kids in school this year, which is so important. Regarding ventilation, yes, we have a schools team here in public health that works with all of our school districts and our schools on effective mitigation strategies. And our two largest school districts have worked to enhance ventilation within their schools. If you have specific questions, you can always reach out to myself or Deb Fetterspiel, our deputy director, and we'd be happy to answer it to a specific school. Thanks, Andy.
All right, we continue to have great questions. Thank you for that. Press *3 if you'd like to get in the line. Bonnie is up next. Your turn. Go ahead.
Hi. I've often wondered how the city of Broomfield or the county of Broomfield is measuring methane leaks from oil and gas fracking. I had read an article, I don't know if it's the New York Times or I can't remember which publication, but it was a while ago, and that said that satellite measuring or finding of methane leaks was highly effective. So I'm wondering what Broomfield County is doing to find them.
Hi, Bonnie. Thanks for your question. My name is Andrew Valdez. I'm the program director of our oil and gas department. So there's two concerns with methane that we have. We have plugged and abandoned wells, which are essentially decommissioned facilities, and then we have active facilities. On plugged and abandoned wells, there are about 110 that are scattered throughout Broomfield, and we have a system protocol to soil gas test each and every one of those on a biannual basis. That is to make sure that the plugging and abandonment was done properly and that there's no subsurface methane that could leak into, say, a basement and cause an explosion hazard. With active wells, we have a quarterly inspections program. We have 3 compliance officers that work for Broomfield. And on a quarterly basis, they go around to all of the active facilities or shut-in facilities with a leak detection camera that can detect leaks above ground and make sure that if anything is leaking, it will be addressed right away.
All right, thank you. Abby, I think you have another one of your colleagues who have some program updates that you'd like to introduce.
I do. So it's my pleasure to introduce our Open Space and Trails Director, Kristen Pritz, who, as many of you know, does a lot in our community. Our trails are amazing. They're super helpful when you have questions, but they also do some really great programming. So I'd like Kristen to talk about some events that they have coming up in their department. Kristen?
Thank you, Abby. I'm really happy to be here tonight, and I'd like to share 2 events with you. On November 17th at 7 p.m., that's a Wednesday, over at the Broomfield Community Center, we'll be having a presentation from Jim Peterson, who is with the Trust for Public Land. He's going to be talking about the power of place, conservation, connection, and community. Throughout the pandemic, so many of us have been enjoying the outdoors in record numbers. And this organization really focuses on providing those open lands and trails for the public. Over the past 40 years, they've cobbled together over $4 billion in public funding for parks and trails. So he'll be speaking about the new state park that was just created yesterday, Sweetwater Lake, and also talking about how they work to ensure that everyone has no more than a 10-minute walk to a great park or open space area. Then on December 1st at 7 p.m. at the Broomfield Library Auditorium, we're going to be showing a film, and it's called Only the Earth and the Mountains. It's a 30-minute film, and it's really focusing on the implications of the Sand Creek Massacre in our country. In this massacre, over 200 Cheyenne and Arapaho people were murdered by U.S. cavalry troops. And the film really focuses in on speaking to the survivors' descendants. And it becomes clear that this event is a living, perpetual loss, one that should not be forgotten. After this film, there will be a panel discussion with members of the Arapaho and Cheyenne nations. We're very excited about this event. It's put on with Creative Broomfield from the library, of course, Open Space and Trails, and also our Broomfield Open Space Foundation. Thanks, Abby, and I hope people will be able to attend these events. They should be really interesting. Thanks.
Thank you, Kristen. Deb, we hear a lot about COVID vaccine shots. There's another shot people should be thinking about this time of year. You want to talk a little bit about that?
Absolutely. Thanks, Roger. So last year we experienced a fairly mild flu season, and part of that was because we had a record number of flu vaccinations, and we hope we can continue that again this year, but also because many of our typical activities were restricted and due to the pandemic. This flu season is already underway. It actually began a few weeks ago, and we're starting to see the numbers creep up. So we really wanted to remind all of you that it's very important to get your flu vaccine. We continue to really remind people that you can get your flu vaccine at the same time as your COVID vaccine or other vaccinations. We are anxiously awaiting our under 12 population in approval of the COVID vaccine, but in the meantime, you certainly can have your schedule flu appointments for your children. We have all, I think, over the past year and a half, really appreciated the importance of in-person learning, being able to parents and caregivers to go to work, people being able to report for not only work, but the social activities that they enjoy. So we want to keep everyone healthy this season, encourage you to get your flu vaccine. All of our local providers, your pharmacies, medical offices have already received their flu supply and are making appointments. And so really just want to encourage you all to go ahead and get your vaccine. And that's one more step you can take to protect yourself and your family and each other and keep illness at bay this winter. Thanks so much, Roger.
All right, thank you, Deb. Again, star 3 to ask the question. We've got about 9 minutes left, so you still have time to get in the queue. Let's hear from a familiar voice, Devin. Go ahead, Devin.
Thank you, Roger. My name is Devin Schaff. I'm a council member here in Broomfield. Some of my constituents have reached out to me tonight and let me know that they did not receive a reverse phone call tonight to let them know about the town hall. They've received phone calls in the past. They've even registered through the city and county, but they didn't get a phone call tonight. And for a lot of them, this is a great reminder when they get this phone call that, hey, there's a town hall tonight, and I'm glad I didn't forget, and I'm glad that I got the phone call, and now I can get connected and listen to it and participate. So that's one question. The other question I have is the police chief talked tonight about prevention of crime, that there's elements that the community can do, and I'm curious, what are those prevention of crime that the police department is actively doing so that we can kind of better understand not only how the police department is following up on that crime, but how is the police department preventing that crime?
Thank you, Councilmember Schaaf. So this is Abby Yeoman in the city manager's office. I want to address the first question about the telephone town hall. I think during COVID, we had the capability and the rules were relaxed a little bit where we could push out the calls to the residents and not really have to have much concern about that. However, that has changed, and we are no longer able to call cell phones unless folks pre-register. So to your question, Councilmember Schaaf, there's a couple ways you can do so. If you go to the city and county's website, which is broomfield.org, so again, broomfield.org, if you just search telephone town hall, or you go to the city council page, you can look for that information under community telephone town halls. And there's actually a form that you can add your phone number to in order to put yourself on the list to receive the calls. You also can text CCOB to 994-11 for non-emergency Broomfield news, which also includes text notifications about upcoming town halls. So again, you can text CCOB to 994-11 to get yourself the notifications for the town halls, because I do think it's important to kind of know when these are happening. We also know we're competing with a Broncos game tonight, so that's a little tough. I will actually throw it over to the chief to answer the second question. Thank you, Councilmember Schaaf.
Yes, thank you, Councilmember Schaaf. So as we've talked before, what we find is about 70% of the people that commit crime in Broomfield aren't actually from Broomfield. They're from surrounding jurisdictions. So we continually work cases through our investigations unit, work with other police departments and jurisdictions throughout the metro area and larger in some cases to not only hold people accountable for the crimes they commit in Broomfield, but also even across the state and sometimes even across the nation. And we filed a number of cases that would fall within the Organized Crime Act just because of the proliferation of crime that they committed. But enforcement isn't enough, as you know. So we do a lot of work with our citizens to help protect themselves from crime. You know, we don't want you to be a willing victim. So for example, we've done a lot on social media and through our website to promote the 9 o'clock routine. You asking people to make sure that your doors are locked, that your car doors are locked, that your garage door is down, then you removed your valuables from your cars. We also do a lot of work in the community at various community meetings, HOA meetings. We've met with a number of businesses to talk with them about different ways to keep them and their employees safe. And then probably our biggest effort has been around the area of Neighborhood Watch. We've added, for example, 5 new Neighborhood Watch areas up in Wildgrass alone in the last few months. So we've been very active in getting citizens involved to help us to catch people that commit crime and prevent future crime from occurring. Because again, the prevention of crime can't be the police alone. We're out there, we're active, but all of you, 75,000, give or take, eyes in this community have much better coverage than we can ever have. And we rely on you to help be our eyes and ears and help prevent the crime that occurs so that we can discourage it in Broomfield and keep Broomfield safe.
Thanks, Chief. We really appreciate that. This is Abby. I just wanted to jump in with a couple more events and things we're excited about. We're so proud of our departments that do so many things to engage the community. And as Roger said, to get back face to face and actually get to interact with each other again is amazing. So I wanted to give a shout out to Catherine Lineup, the director of the Library Arts and History, along with her team. They've got some great events coming up, including Jarabe Mexicano, which will be at the Broomfield Auditorium on November 3rd at 7 p.m. Go on a joyride through a versatile songbook of Mexican folk, as well as rock and roll, Tex-Mex, Latin rock, and reggae at this exciting in-person concert. You can learn more about that at creativebroomfield.com. As well, so this one might be my favorite because, you know, it's Halloween and you get candy and have a lot of fun. So they're doing a great Halloween bike and walk event along the artery. So on Sunday, October 31st, beginning at 10:30 a.m. until noon, it's time to get spooky on Halloween by enjoying the outdoors and hauntingly fun activities, all while exploring the first stretch of the new Artery Trail. Starting at the Broomfield Library, walk or bike your way to the Bruner Farmhouse and Gardens in your best Halloween costumes. So your best. We're kind of throwing out a call to our community. We want to see your best costumes. You get to enjoy some live music, trick-or-treating, a costume parade. There's going to be food trucks and all kinds of things starting at 10:30 a.m. on October 31st. And we would be remiss if we didn't thank the Broomfield Council of the Arts and Humanities for partnering with Creative Broomfield to bring spooky fun to the artery and open spaces. Food donations are also encouraged that day, so please think of Broomfield Fish and bring your food donations, and we will pay it forward a little bit to our community. And I also wanted to mention too, there's a lot of ways that our communication team works to keep people engaged and make sure that they're receiving information. So if you want to stay informed about what's going on in Broomfield, the Community Update is a weekly email with updates and information about important city and county of Broomfield news and events. You can subscribe today at broomfield.org/be in the loop. And just one more announcement. It is that time of year. I don't know if anybody's noticed, it's getting a little bit cold out there. We have a lot of seniors in our community, and as we all remember from March, that snow was crazy. It was a lot and it was heavy. So our Snow Pals program is seeking volunteers. Help your neighbors during the winter by providing support with snow shoveling. To learn more about our Broomfield Pals program, please visit broomfield.org/Broomfield Pals. And again, let's all kind of put ourselves out there and help our neighbors this year with snow. And hopefully we have a lot of it because we like snow in Colorado. So Roger, thank you. I'll turn it back over to you.
All right. Thank you, Abby. Well, Mayor, it's been a great conversation this evening. Do you have any final remarks?
Yes, thank you very much, Roger. On behalf of myself, Mayor Pro Tem Jezierski, and Councilmember Anderson, I want to thank you all for joining tonight's community conversation. Please remember, you can always stay connected at broomfield.org and contact us directly. Again, Roger, back to you.
All right. Thank you, Mayor. We have come to the end of tonight's community conversation. Thank you so much for giving us an hour of your time tonight. Stay healthy and have a good